All right, we're going to go ahead and get started on our next panel. And if you've been joining us, our next panel is around digital equity and inclusion. If you are new to joining us and just missed our keynote session with Peggy Schaefer and Tim Schneider, no worries. We will you'll be able to watch the recording of this. It'll be posted on the NBC website next week. And if you are just now joining us as well, I just want to reiterate, if you could just stay on mute. If you need to call by phone, you can do that as well. We'll throw that number in the chat. But if you want to ask a question, if we have the ability to ask live, instead of just through the chat, you'll need to press *6 to unmute. Throughout this time, if you do have a question, go ahead and put it in the chat. If we have the opportunity to ask live, you'll be able to come off mute and do so. But we really want to see them in the chat so that if we don't have enough time for all of the questions, we can follow up afterwards with answers from all the panelists that you've heard from. So I do want to just go ahead and spotlight our moderator for this session. This is Susan Corbett from the National Digital Equity Center, and she's been an incredible partner in broadband for several years and sits on the board of the Connect Maine Authority and was critical in helping to plan the summit that you're seeing today. So with that, Susan, I'm going to hand it over to you and let you kick off your panel.
Great. Thank you, Kendra. So good afternoon, everyone, and welcome to today's discussion on digital equity and digital inclusion. My name is Susan Corbett, and I am the Executive Director of the National Digital Equity Center. The goal of the National Digital Equity Center is to close the digital divide in Maine and across the United States. Today, we're going to talk about digital equity and digital inclusion and what it means, and how we can all work together as one unified voice to ensure that none of our citizens are left behind in today's digital economy. I am pleased to be joined by my colleagues, Paolo Balboa from the National Digital Inclusion Alliance, Danielle Lauder from the New England Telehealth Resource Center, Lynn Withem, former director of the Dear Isle-Stonington Adult Education, and Mary Ellen Barnes from Lincoln County Regional Planning Commission. Before we turn the discussion over to our panelists, let's first take a look at what digital equity and digital inclusion means. Digital equity is a condition in which all individuals and communities have the information technology capacity for full participation in our society, democracy, and economy. We saw how deep the digital divide was when the pandemic hit. Students who may or may not have had a broadband connection because the family could not afford a subscription or broadband was not available. Remote workers who may or may not have had a broadband connection or not enough of a broadband connection for the entire family to be online for remote work or remote school. And then there were the older adults in our state that were already struggling with isolation and loneliness, and then they had to shelter in place. Many of our older citizens did not have a broadband connection or a device to connect to the internet, or perhaps did not have the digital skills to navigate being online. Digital equity is necessary for civic and cultural participation, employment, lifelong learning, and access to essential services. We reach digital equity by promoting digital inclusion, which includes affordable broadband, affordable equipment, digital literacy training, and public computer access. So let's get started. Paolo, what's happening on the national level around digital equity?
Yeah, thanks, Susan. And before I answer, I just want to say thank you all for having me here. It's really nice to be here with everyone to hear about what's going on locally in Maine, because the organization that I work for, NDIA, has the national perspective. So I'd love to hear from folks on the ground. Nationally, the digital equity world is booming, right? For better or worse, the COVID-19 pandemic really shined a light on the need for digital access, and I'll take a step back there, equitable digital access, especially for historically marginalized communities. So over the course of the past year, there have been these rounds of funding from the federal government, most notably the Emergency Broadband Benefit, which is a $50 a month subsidy from participating internet service providers to get eligible historically marginalized communities affordable broadband at home, which, as Susan noted, is one of the pillars of a digital inclusion program. Other avenues for these rounds of federal funding have been better programming on the ground. So a program like Digital Navigators, for instance, which NDIA helped develop with our community of practitioners and advocates over the past year, has lived in places like a public library, for example, that has offered digital inclusion adjacent services. And especially in the COVID-19 pandemic, we've seen public libraries take a more intentional approach to offering a holistic program wrapping around the needs of their community members, right? So this goes beyond simply lending out hotspots or lending out laptops. As great as those programs are, we're looking at now getting devices permanently in the hands of community members who need them most, because we see that there is definitely an impact between a library patron or a community member just getting a device lent out and how they interact with it versus them actually owning a device and seeing the sorts of places that they can go when they know that they don't have to give it back in 4 to 6 weeks. So we're really trying to use or to guide organizations and municipalities on the ground to sort of use these huge pots of money very intentionally and super usefully. So I'm happy to talk a little bit more about that over the course of our discussion.
Thanks, Paolo. Danielle, the world of telemedicine really opened up with the pandemic. What are your thoughts about this?
I have a lot of thoughts, Susan. And I can't possibly cover them all here today, but once again, thank you to everyone here for sharing your time. We know that everybody's exceptionally busy, and this is just an exciting time for broadband expansion. I think everybody would agree that one of the few silver linings of the COVID-19 pandemic has been that it's promoted this seismic shift in the telehealth landscape, allowing for much more broader utilization and reimbursement of telehealth services and different types of modalities, both under federal and state public health emergencies. In years past, and it remains, there's been a fairly complex reimbursement policy environment to navigate for healthcare providers, for patients and families. And the door blew wide open under COVID-19 and has just really presented much more opportunity for innovation and utilization across many different types of healthcare providers, from CMS, broadening much more broadly their flexibilities for different types of providers, different types of services that are eligible for telehealth under that public health emergency, which has actually been extended through January 13th of 2022 now. With COVID cases continuing to be on the rise, I wouldn't be surprised at all if we see another extension. They tend to go in 90-day periods. And so it really has addressed many of the barriers on not a permanent basis yet, but we are seeing policy that's being looked at, and it tends to be a bipartisan issue with lots of support. And we are very fortunate in the state of Maine to have our congressional leadership has been very supportive, not only of broadband expansion, but of telehealth expansion, even pre-COVID. And so we have been fortunate in the state of Maine with our MaineCare, our Medicaid policy, and our commercial payer policy, even pre-COVID, has been very supportive of broad utilization of telehealth, allowing many different types of providers and services to be eligible for telehealth. But the lack of consistency between federal and state policy has kept it from being much more widely utilized. But seismic shift during COVID. And, for us, we're a telehealth resource center serving all of New England and New York. And so, as you might imagine, the number of technical assistance requests that we have gotten certainly during the early months of COVID, and now again, that numbers are cropping up, has just been exponential. But that's an excellent problem to have, right? We've been kind of waiting for this type of opportunity. And certainly in a state like Maine, I think it was Elizabeth M. who mentioned, we're going to continue. We're one of the oldest states in the nation, if not the oldest state in the nation already. Not one of us is getting older, right? As each day is getting younger as each day goes by. And telehealth is going to continue to be extremely important to help us save time, save money, to serve older adults in their homes with things like remote patient monitoring, and being us from having to travel 3 hours to get a 15-minute consult in Bangor or Portland or wherever it is that you live and that you receive your healthcare services. And we've seen a lot of that happen and being allowed to happen under the policy changes and flexibilities. And people really kind of opened their mind where they may have been a little bit hesitant to utilize telehealth services, or maybe they, that's the other part of things. While we've seen a massive increase in telehealth utilization, as you mentioned earlier, the pandemic has also unfortunately shown a light on the disparities and the inequities. When you don't have broadband or you don't have funding for devices that allow you to do a live audio video call, that has really shown, unfortunately, that light and made a bigger gap. And so we've been trying to, of course, I think many people who are passionate about this through broadband expansion and all of these funding opportunities have been working hard to address some of these gaps, whether it be through broadband. We're working with folks to ensure that folks with disabilities are able to access telehealth services. So you have to consider the audio and making sure that folks can hear, or if folks have physical disabilities, that they have access to telehealth services in a way that meets their needs, et cetera. Same with different populations, new Mainers here in the state. And there's a lot of opportunity, and there's been a lot of innovation, a lot of incredible. We were absolutely amazed over these past now almost 2 years, if folks can believe that, right? Doesn't it sound incredible that we've been kind of dealing with this for 2 years? The innovation, the ability for people to very quickly adapt. Another thing, and I think it might have been Churchill who mentioned, never waste a crisis. This has been an opportunity for us to think through that and very quickly pivot and act, whether it be, to jump forward and start to address, issues with connectivity adequacy, but then also how do we implement new programs for telehealth, et cetera. I could provide many different examples of the innovation and the incredible work from our partners in healthcare and different types of organizations that serve stakeholders to improve the health and well-being of the people here in the state of Maine and well beyond. But working with partners at the University of New England to ensure that their sexual assault nurse examiners could do their preceptorships, but in a tele way. So just got really creative in figuring out how can we use technology to make sure these vital services are still happening. We've had more colleges and universities reach out in the past couple of years to say, we understand now that we need to incorporate telehealth training into our core training curriculum for nurses, for physicians, for PT, OT, and physical therapy, occupational therapy. I'm going to try not to use those acronyms. So just incredible opportunities in that telehealth space. Audio only, that's been something that's also been allowed from a policy perspective that was never allowed pre-COVID. And we're not sure from a permanent perspective what will be allowed after the public health emergency ends, but it started a lot of very important conversations around equitable access to telehealth services. Audio only, that allowance to provide mental and behavioral health services, substance use disorder, opioid use disorder services via telehealth, and specifically allowing audio only, particularly for people living in rural and underserved areas, has literally been a lifesaver during COVID-19. And so it has started that discussion on how can we continue to ensure that audio only is somehow continues to be included for Medicare. Maine Care has already, in the state of Maine and their private payer policy, have already passed permanent changes to allow audio only. So again, Maine leads, right? That's where Jericho, we lead, and we like to continue to do that. But there's a lot of, I could talk all day, as you could probably tell, and I'll stop there, but there's just been some incredible opportunity with respect to expansion of telehealth, innovation in telehealth, and further opportunities moving forward. So I'll stop there and let us move on.
Thanks, Danielle. I think I heard a statistic at one point that telehealth visits increased by 13,000% across the country post-pandemic.
You got it. And if you look across different payers, Medicare in the early months, huge explosion. And then you look at Maine Care, and we had some private payer data that folks were willing to share, and you could look across the board and it was about the same. And of course, we're starting to see, people do want to go and see their providers in person, and that's great, but they want a hybrid model where they can, for certain things, they do really appreciate the opportunity. A parent with 3 kiddos that they don't have to drag to the primary care office when there's a quick tele visit that could be possible. So people had patient satisfaction was very, very high. And I do have some articles. I have a slide deck that I'll share out with everybody. If you really want to dig into some of the data and some of the articles and trends, I'll share that with the team, and they can share it out to all attendees. And happy to always talk with folks and share different models and outcomes and things like that if folks would like to learn more.
Great. Thanks so much. Lynn, so many of us 40 and older have had to learn computer skills. You've worked with so many adult learners. How important it is having the right digital skills?
Yeah, it's so important. And I have worked with adult learners, both in adult education and the university level, supporting adult learners primarily adult learners for the past 15 years. And so I do have a slide deck that I'm going to share with you, mostly because it'll keep you from seeing my cat trying to get on screen. Let's see if I do this properly. Okay, now let me go. See, this is one of the skills that I don't have very well, using slide decks on Zoom.
You should just be able to click present right next to where you were. Over to the right.
Right, it's saying present using a meeting code, which is bizarre.
Just click on the word present to the right.
Oh, okay. That's because the little, I have to move my little, there you go. Okay. Now I've got it. Thank you very much. See, this is, you're seeing a view of the Deer Isle Bridge. So I have been doing adult ed here for 5 years, and we're a pretty isolated and remote place. And we are one of of course, Hancock County is the oldest county, I think, in the country. And there are over 600,000 adults over the age of 40 in Maine. And I believe the average age on the island is 58. So we're we're heading up there. But there's so many skills that if you are not a digital native, like, I mean, I'm 65, just turned 65, and I was an early adopter of computers. Like my husband and I ran a construction business, and so we had one of the earliest Macs they ever had. And but it's just grown so exponentially, and there's so many skills that you have to have. The breadth of skills that are necessary now for adults to function in various capacities is amazing. So just if you look at workforce skills, everything that used to be done on paper is digital now, and that all takes you using all these different applications. I mean, there's spreadsheets, there's documents, PDFs, JPEGs, Google Drive, how you share things on Google Drive, how you work together on things, databases, and then the whole world of social media in terms of marketing, communication, and payment apps, financial things, your banking, your reporting, everything's out there online. All our meetings are now like this most of the time, because we realize, like, oh, it's easier than people driving to meet each other. We can just do this. But there are all these different types of applications for meetings. I mean, there's, there's Zoom, there's Google Meets, there's Microsoft Teams, and like for other you can use certain browsers for some, and you can't for others, and you have to have them all downloaded on your computer. And I mean, event and conference registration, we in adult ed, we use CourseStorm. We now register everybody online. If you don't have a device or you don't know how to use that registration online. Like you can't even sign up for your basic adult ed course, and unless you call or try to come in. Purchasing, all the things that we need to buy for our businesses, for our companies, it's all online. So that's just a huge piece. And then you get to like education. And yes, so our COVID response has been that we all have to be able to go remote in the blink of an eye in terms of education. That's what we've all prepared for now, from K-12 to post-secondary to adult education. Like nearly all the programs in Maine are now at least partly digital. And you have to know how to use the meeting apps. You have to know how to use the digital documents. There are all these different learning management systems, from Schoology to Brightspace to Blackboard. They all work differently. If you're not a digital native, you're not necessarily fearless about just poking around in there and figuring out how to use it. A lot of my adult learners, especially my new college students, when I was working with them, were afraid. They were afraid they were going to do something terrible and ruin everything if they just clicked on something. And that's something that you really have to teach people to go beyond. But it's there, it's very real. It's like math phobia, it's digital phobia for some people. Adult education has played a huge role in like trying to give adults in Maine these skills. We've had great partnerships with the National Digital Equity Center to be able to offer their courses through our hubs. We have 9 hubs in Maine, so we're kind of divided mostly by sort of county sections. Hub 1 that I'm in is Hancock and Washington counties, and there's 70 different adult ed programs spread out through Maine. But we all, as COVID hit, we all had to start providing remote learning if we weren't already. Many of us were already, and one of the good things about the hubs is that many programs can share classes across the hub remotely now. And so we've really upped the ante on that. We did have some funding that went into a continuity of services grant. Each of the hubs got funding to basically figure out, like, how are we going to do this when our people can't come to us? And so it went from, we got devices that we loan out. We developed more, we got hotspots, we got all sorts of things to reach out to people. We even went back to buying some old school workbooks for people who did not have digital access. And then the other thing that happened in education is when you're a parent, oh my God, your kids are doing remote school and you're helping them do it, right? And you have no idea. You don't know how to use Google Classroom. You don't know how to get them on Zern. You don't know how to use Zoom. It's just been a huge, huge learning curve for everyone. But that's part of the regular parenting thing. The other thing for parents is some parents have had to go remote and work from home because their kids are home and they don't have anyone to leave them with. People have found that, and some people found, I think they prefer that. It's interesting how the whole workforce is changing in terms of how COVID has made us reconsider like how we're spending the time in our lives and how we want to be spending it. But the other thing that makes it even more important for people in Maine to learn these skills if they don't have them is because I don't know if it happened I know it happened in other places in Maine, but here in Deer Isle, the number of people buying houses here on Deer Isle from out of state, sight unseen, like the market has gone crazy in the last 2 years. And so lots of people are moving in from other places who for a long time have had more access to technology skills and who are able to remote work. And that's who we are now competing against in the workforce. So that's something we really have to think about in terms of getting skills and access to our residents. And then there's just the whole aspect of communication, like during COVID, how are you going to talk to people? And so a lot of it happened over the internet. You had that accessibility, but we just take it for granted now. When you apply for most jobs now, very few people go in person to interview anymore. Most of the interviews are Zoom. You know, it may be a phone interview to begin with, and then a Zoom interview, and then maybe finally, if you're a finalist, maybe you're brought to the place. If your business is even working from a place anymore, which it may not be. Digital resumes, like everything is done over the internet. Family and friends, staying connected in isolation, like for people who were isolated by themselves during the COVID lockdown, this digital access was maybe the only way they ever got to communicate with anyone. And like, it's basically, it's like being in prison, you know, if you don't have that outlet. And then meetings, all our meetings are like this now, community groups, boards, telehealth, events, church, you name it, it's happening. It's happening digitally on all your transactions, shopping, paying bills, banking. Sometimes it can be really hard to actually find when you're shopping. Sometimes I have to put into our school database for purchase orders, you have to put in a vendor location and address, and sometimes it's not even on their website anymore. You know, it's like, what's their address? I have no idea where they're located because they are out there on the internet. This is how we get information now. Like, how do you fix it? What is this? My daughter has an app that she's really into lichen and fungus right now. And I mean, she's 41. Like, this isn't like a 12-year-old. She does this on her walk to work. And she takes a picture with an app and it tells her what kind it is. And then it puts it up on a website and she can learn more. My husband, when he needs to fix the car, he finds a YouTube video, you know, that shows him how to fix that particular thing. I mean, that's how we do it. And entertainment, you know, it's all out there digitally. And for people over 40, most of the things we're buying now are smarter than we are. I mean, the cars are smarter than we are. My TV is smarter than I am. Like, all my devices are smarter than I am. You know, you can run your lighting and heating from your smart home if you can figure out how to do that. So there are all these things that are just part of everyday life now. And we have been working hard in adult ed to try to help people cope with this. And the other piece that, you know, it's a bit of inequity there is that in terms of who can actually own devices, as well as a broadband access, who can own devices, what kind of device can they afford to have, and have they been able to have the time to learn the skills to use it. I was just thinking, we have some people taking classes, and we have a lot of retired people from other places here in Deer Isle, and a lot of them come in with new iPhones and this and that and the other. And then I'm thinking, well, the other people at home or maybe have some, you know, really old generation Kindle or some kind of track phone or something. And that is really limits like how many people are included in digital equity as well. I don't know how long I've talked, but that's sort of, that's probably enough.
Lynn, thank you very much. This was a wealth of information for all of us. We appreciate it. Mary Ellen, you've been involved in community broadband planning in your region and have been a longtime advocate for digital inclusion. What do you see as a priority? You're on mute.
Sorry, I thought it went there, but anyway.
There you go.
So thrilled to meet the other panelists. So I'm like to hit on some points that other folks have already covered, but I think what we're looking at in Lincoln County, which we've kind of used the lens of digital inclusion since we got going in the work back in 2011, 2012, with all the development work and technical assistance work we provided to towns. But right now, I think that what communities are looking for is more public resources, more publicly available, whether it's through rec centers or libraries. I think there just needs to be a greater expansion of what's publicly available, because as Lynn and others have said, not everyone can afford to have the best internet to their home or to have devices. So I think what we're looking to do is turn a little bit of our work from assisting towns with getting the infrastructure itself really into developing concrete plans around digital inclusion that will actually mean something on the ground, whether it's in Damascata or Noblesboro. So I think a lot of people, we're still having some communities, as a enrollment state, some communities are still coming to an early stage of understanding how important broadband is. Danielle did a fantastic job of the telehealth crisis and other kinds of issues we had during the early months of the pandemic. But some communities are still feeling as if, well, we managed, so let's not consider that we actually, as a town, need to take a lot of action. So I will just say that what we're hearing is just the increasing importance of community conversations, as Peggy mentioned. Our organization works with the Island Institute and others on supporting community committees, and sometimes we have now a couple towns who are working together, and that may evolve in terms of a multi-town process. I will say that just in terms of explaining how we are as a regional planning commission, we've been providing economic community development, land use planning, sea level rise work since the late 80s, early 90s. So it's been something we've been doing, and certainly broadband since the three-ring binder went by my door, like, what is that, 10 years ago now. So, but to your point, we're looking for a broader engagement of the community in these committees that are being created and are lasting. So as you know, what was it called before, the town cable committee or the franchise agreement committee, and now it's broadband and it's broader. And so I think we're trying to work to make sure there's a diversity on these committees, and that they're reaching out to a lot of other resources here. We've been fortunate the last couple of years, I think, to host NDEC's program, and now we're hosting your home office here. So in our office in Wiscasset, so we expect more partnerships with Susan and Marita. But we're also seeing that there's just a lot of other resources out there. As Daniel suggested, there's a lot more innovation locally here. We have communities that have some phenomenal marine research centers, and we're finding them being partners with our communities in a whole broader way than they were 5 years ago and 3 years ago. So I think what I would just recommend is that communities look to where their strengths are: tourism, aquaculture, or manufacturing and engineering. Bring some of this leadership into your processes here, because it's going to make a big difference with how we're communicating with the selectmen, our voters, chambers of commerce. So I guess we're looking for greater diversity and more concrete inclusion plans.
That's awesome. Thank you so much, Mary Ellen. And thank you for being our landlord. We really appreciate that. All right, so we have some questions from the audience. Danielle, I think this one's probably right to you. It says it's not directly tied to broadband, but do you have any thoughts on how reimbursement rates for telehealth are likely to go down post-pandemic, driving more and more providers to end the program within their practices?
Yes, and I do have a rather long, it actually shut me off. I had too many characters in there. I'll hit send in the chat with a long answer, but it's less so the rates. I think the state of Maine has had a very progressive telehealth reimbursement policy for many years. We actually further expanded that last June when we permanently expanded some of the allowances that we had under our executive order during the public health emergency. For example, we now have audio only codes that are covered under telehealth. The other great thing about Maine Care, and it's a very important distinction, but it's one word: payment parity versus coverage parity in our language for our policy. So Maine Care pays at the same rate as they would in person. Our private payer policy, we have coverage parity. So they must cover it via tele the same as they would in person, but it doesn't state that they have to pay at the same rate. Although we do have data that shows that the private payers in the state of Maine do typically cover at the same rate. The question is different, or the answer is different at the federal level. Right now, payment parity is in place under the public health emergency, but we don't know if that's going to be a permanent thing. That's one of those things that has to be changed by Congress. It actually isn't, it's part of the Social Security Act, the definition of telehealth and the rates and that type of thing. And so while it's currently in place under the public health emergency, we're not sure what that federal policy will look like. You are absolutely right. We do have, and understandably so, some large health systems and some providers who are reticent about making big commitments to time, to personnel training, to the technology, to launch telehealth programs, with uncertainty around that federal policy, right? And we can't blame them. The great thing is that, Maine does have a very positive landscape as far as telehealth utilization and expansion. So we'll see. There are over 1,000 laws that are at least relevant. Some are very specific to telehealth in the 117th Congress right now, many of which would do away with some of these longstanding barriers, like the rates, the patient originating site restrictions, some of the providers that weren't eligible, some of the services that weren't eligible prior to COVID. So to me, it's from Medicare's perspective, it's more about taking away some of the flexibilities that we've had during COVID that have just allowed telehealth to blossom and for people to innovate, like physical therapy and occupational therapy. They weren't allowed to provide services under Medicare previous to the public health emergency, and now they are. And man, they're innovators and they're doing incredible work in that realm. And so Obviously, we need some permanent policy changes to happen. But then there are also large health systems and providers who see a hybrid digital health strategy as the future, and whether they understand that they might have to wait for the federal reimbursement policy to change, but they just see it as a way to, we've got workforce shortages, right? And that's not just healthcare, that's across the board in every sector, but they see this as a way to address workforce shortages, not putting people on the road when they don't have to, both from a cost and a risk perspective. Patient no-show rates go down considerably with telehealth. So there's many different reasons that the return on the investment, they see it as enough to invest in the technology.
Great, thank you so much. So this is a question for the panel. When should a community start focusing on digital inclusion and literacy if they're trying to expand broadband access? Paolo, maybe you can start us off.
Sure. Yeah, I think that's a good question. And it does address the sort of tiered way that we've seen communities build digital inclusion programming. Like, it does begin with getting infrastructure in the ground. And we know that in rural areas, sometimes that access just simply isn't there. So this is where a solution like a Wi-Fi hotspot can come in. Of course, public computer centers, a public library, those are definitely resources. I think that to address the question, digital literacy and training cannot come unless you have that access. And so I think getting devices in the hands of community members, making sure that the broadband is actually built out is when the training can begin. That's in a bright and shiny world. We know that that's not the reality, however. We do know that a lot of households that their main device to access the internet isn't a laptop, isn't a desktop, but it's usually a smartphone, which is really, really interesting because, people can figure out how to make calls, folks can figure out how to connect with family and friends on Facebook, usually with the help of a younger family member, for instance. But we need to get folks on a laptop, because I just think through, doing what I would call a more simple task on a smartphone, like attaching a file to an email. Doing that on a laptop is okay. And having been an adult education trainer in a previous life, that takes some steps to walk someone through, but we can get there. But thinking about that on a laptop versus doing that on a smartphone, it's a completely different story, right? It's unnecessarily difficult. To go beyond that, just to dig in more on the smartphone reliance, some government forms that folks may need to fill out for eligibility requirements just aren't formatted for a mobile device. Some buttons won't work. The submit button won't show up where it needs to be. So we need to get, I think that the priority is on like the physical piece, right? So again, that's building out broadband, getting an appropriate device in folks' hands. And then that's where the training, the teaching can begin.
Great, thank you. Lynn, Mary Ellen, or Danielle, any thoughts on when should a community start focusing on digital inclusion and literacy if they're trying to expand broadband access?
Yeah, I appreciate what Paolo said. Absolutely, we're all working to switch off from DSL to something much better. So I know we're still keeping a lot of energy going around that. But some of our small towns, maybe a few years off, but they share a library or they share a Y or a rec department. And I think there's opportunities through some of the regional or multi-town community centers, if you will, that could provide or do provide already digital access. And so I think sometimes because they've been sharing these libraries, if you will, for centuries, I think they're probably already tapping into some of the expansion of the programs that either Lynn does in her federal aid program or Marita might do through some of the libraries in Lincoln County. So I think there's some resources there that I'm not sure I would ask people to wait, but I think there's an opportunity to jump on things while we're still trying to tap into Connect Me and the Connectivity Authority.
And we're definitely doing that in Deer Isle. and actually in partnerships, and I know Healthy Island Partnership has a group called Saltair Seniors, and they became concerned about isolation of seniors, like doing this. So they have got an Island Institute fellow whose mission is to work on digital literacy and devices with seniors. And so someone we're partnering with that in adult ed. And in adult ed, we've been working on this for a while, also because Maine College and Career Access is part of our adult ed services. And so for people looking to change jobs or take workforce trainings or go to college from here, you know, it's pretty much distance learning. And so that's been part of Maine. MCCA has been part of adult education statewide for, I mean, the career part for at least 10 years. College transition's been around for like 20. So I think we're all, as each organization in a town looks at how their population is doing, particularly under COVID, I mean, that has been sort of the, you know, the disruption that has made us all pay attention and say, hey, you know, how are people being served? And each organization looks after it in its own way. And we have a lot of coalitions around here that work together for that while we are working towards broadband.
Great, thanks.
All great points. And I just got to say, I love Saltier Seniors. How cool is that? Like, that is the best thing. So, and I would about also like proactively preparing people, right? So when we do, because when we do get our, you know, broadband where we need it to be, our connectivity where it needs to be, they'll be ready to utilize it and feel comfortable and competent and confident with it. I come from a public health background, live in a global public health organization. So the whole like community-based, nothing about us without us, right? And that we are working with those groups all along to make sure that we're developing resources that are going to help them to really leverage and digital health and digital equity moving forward. So.
Great, thanks. So not a question, but a comment that we'll share with our panel and our audience. The future of telework is a fascinating tangent here. It could be the 21st century, what the 40-hour work week was to the 20th. The family-friendly, community-friendly, self-sustaining labor market reform that enables broad masses to more fully enjoy the fruits of technological progress. Also great for reducing carbon emissions, but that might depend on universal digital literacy and universal broadband. We all agree, I'm sure. All right, on to the next question. How do you measure progress on expanding digital equity and digital inclusion? So I'm going to start that off because at the National Digital Equity Center, that's an important component of what we do. We have consultants, and we will have more consultants that will help us measure those outcomes. And questions like, does digital literacy lead to higher educational attainment by taking other courses once you learn how to navigate being online? And does that mean that you can have higher wages, higher per family median income? And for our older adults, does it help combat isolation and loneliness? Can people stay in their home longer with the help of technology? Anyone else on the panel want to add to that piece here?
Yeah, I can jump in. First, yeah, I just want to completely echo your thoughts, Susan. I think that one way to measure to track measurable growth in digital equity, especially from a programs perspective, is tracking outcomes, which, you know, with more attention, more focus on digital equity work, we're finally allowed to do that. So, you know, having a program where we can ask folks at the beginning, you know, what generally, like, where's your skill set? Like, how comfortable are you using a computer? We know that privacy and security are concerns, especially among the older adult population. So after participation in a program, it's so fascinating to see how those numbers grow, right? That's the immediate impact of our work. And we can really see it, like, oh my gosh, this person is benefiting from having access. That's so amazing. And that brings value to this. Going beyond that, you know, as programs are able to show or to demonstrate outcomes with their work, whether it's someone finding gainful employment, seeking higher education, you know, not feeling as lonely, whatever it happens to be, that means that they can turn to policymakers and say, hey, this program works, it should get more funding. Right, like that's the through line of where I think this measure the measured outcomes of digital equity can go. I'm just going to switch gears and answer that in a different way really quickly and share my screen. Another way that I would measure the impact is that this stuff got signed into law earlier this week. President Biden just signed the infrastructure bill. I'm usually, and well, just while this loads, I will just say that I'm usually not a big text on slides person, but policy isn't quite my background. So I think it's just useful to have this outline for us all here. Right, the Digital Equity Act got signed into law earlier this year. NDIA and our friends across the country have been working on getting that through Congress for the past 5 or 6 years. We also have the words digital discrimination in this bill, which refers to a practice of digital redlining, in which internet service providers would historically not build out service to marginalized, and in parentheses, that's usually Black and brown or rural communities. So being able to get that practice signed into law and giving the FCC a mandate to basically tell ISPs you can't do that is huge, right? So like, I think that getting this signed into law is a way for us to track progress. We've been banging the drum on the digital equity, digital inclusion in the digital inclusion world for a long time. And now people are recognizing the hard work that folks on this panel have been doing, folks in this room have been doing for the past few years as well. I know it's a lot of text, but just a few of these items to highlight. That middle mile connectivity, the bottom right bullet point, that's infrastructure, right? That's building out more infrastructure specifically to rural communities to be able to get folks access where they haven't been able to access as well. Also from an equity standpoint, the one right above that, the tribal connectivity program, specifically for tribal communities, right? Like that is a huge win for equitable access, especially because it addresses the needs of tribal and native communities. So I'll just pause there. We love the infrastructure bill. We're so happy it got passed.
So full disclosure, I'm on the board of the National Digital Inclusion Alliance, and there was a lot of celebration that went on when the infrastructure bill was passed, including that Digital Equity Act. So thanks, Paolo. Lynn, what are the different ways schools are providing remote education? How are they helping families who don't have broadband access?
So we've had to make a big sweep and look at every family. I mean, our school district isn't that big, but every school district had to be in that. And we've had to use ESSER funds and so on to provide hotspots. And sometimes it's like, which hotspot can we make where, you know, and get devices. We've had to, so there's different ways people have been doing remote. So some people have been doing remote only asynchronously and like basically by putting assignments up in Google Classroom. Some teachers are doing, we equipped all our classrooms with cameras and sound bars, and we were able to Zoom students at home into the regular classroom once we started kids back in the classroom, but some kids still, their families wanted them to be remote or they need to be remote to quarantine or for what other reason. So there's that kind of simultaneous thing going on. We've had teachers who are recording lessons and then putting them out there for kids to watch through Google Class. I mean, down here, we've primarily been using Google Classroom, but they've been using different learning management systems in different schools. So everything is kind of different, and it has to be different by grade level. Like what works well with high school students does not work well with kindergarten students. Like if you try to imagine even doing remote teaching with kindergarten students, like that in itself is like really difficult, but it has to be synchronous and you need to have a parent there. And so that's been, that provides its own set of difficulties. We have to teach the parent how to use all this. But yeah, so that the devices immediately, we made sure every child got devices one-on-one. Every child has a device. We have to be ready to pack up those devices and send them home with kids at a moment's notice. Everything's in Google Classroom. You know, you learn how to like, this is how we're doing it. And really right now it's wilder than during the lockdown or during last year, because with the quarantining and the variant, it's so much more contagious. There are a lot more cases of it. And we don't know who's going to be in the classroom or out from one day to the next. We finally got pool testing here, which makes it a little bit easier and better to control, but our staff is out. So yes, we need to, yes, we need to like be able to like have some sort of like Yes, a smart, yeah, we have an app that creates a smart teacher in the classroom so they can be like operate a robot from home when they can't be in the classroom, because we have our principal and guidance counselor covering classes because we're out of subs. But it's been a struggle, but there are so many different ways that the schools are using remote, but absolutely making sure every student has some access. And Stonington's been great down there. Kathleen, the Billings, the manager, has been working on broadband, and I think she's got the whole town done now. Deer Isle's still working on it. But we totally rely on hotspots, and we've even like what hotspots will work on Isle-Ho, like that's another whole can of worms. But the money that schools have been given through ESSER, much of it has gone to make sure that the students and the parents all have digital access.
Great, thanks, Lynn. So here's a great question. What do you think is the bigger hurdle, affordability of access or providing access where there isn't any? Mary Ellen, I know you've got an answer to that one. Oh, you're on mute.
I think still the major drive of our work is really to get broadband to people. So I would think access to broadband services and improved broadband services to me is a priority. I can't say that I follow all the pricing of all the businesses of all the ISPs. So in one sense, I was hoping that eventually the service would be less expensive over time. I don't have the best read on that, but I would still think prioritize infrastructure.
Great. And other panelists, thoughts on that?
I think I might lean the other direction, because if we have access but nobody can afford it, then it's kind of like, it's kind of setting us up for failure or non-utilization. And we do, I would say, during the beginning of the pandemic, constant outreach from providers saying, what do? We have patients who want to use technology. They either don't have broadband or they don't have the funds to get the data package that they need to do live audio video. And that's, audio came in, audio only, and it was allowed, and that was great. And as I mentioned, it's been a lifesaver. But not knowing, what audio only will look like from a policy perspective moving forward, I think we've got to have affordable connectivity, whether it's broadband, whether it's other, as long as it's adequate, like that 100 over 100, that's broadband, but there are other definitions of adequate that could meet people's needs for, live audio video. And so I think I would lean that way.
Okay, I've just been told we have time for one more question. We just have a few minutes left. Danielle, there's a question from one of our participants, and hang on, they're very interested in a large telehealth project anchored by a rural hospital. Is this possible with current federal programs?
Yes, Mark and I are already connected via email, so we're going to talk next week maybe. But so anyway, absolutely. So we have traditional funding opportunities that are specific to telehealth and have been for years. So for example, the USDA's distance learning and telemedicine, which Maine has actually been very successful in getting some of that funding. That's really all about funding infrastructure and technology. It doesn't support like who's driving the bus, the project management side of things. There are other funding opportunities through HRSA, Health Resources Services Administration, and others. And we're continuing to see additional new funding opportunities because there's been such importance on telehealth. And even, we're seeing traditional opportunities that aren't specific to telehealth, but people are utilizing those funding opportunities to include telehealth implementation in their proposals, and they're getting funded because people do see that, the federal government, the state government sees opportunity for addressing workforce shortages and access issues and all of this. So there's a lot of funding opportunities out there. I think there's going to continue to be more. Reach out to the NETRIC, the Northeast Telehealth Resource Center. That's one of our charges from HRSA. We are federally funded through HRSA's Office for the Advancement of Telehealth to provide technical assistance and resources to get people up and running with telehealth. We write letters of support. We help out with workflows and all of that for grant proposals all the time. So please reach out to us and we'd be happy to help.
Great, thanks, Danielle. So we want to thank our audience for joining us today. We hope that you leave this session with a lot of information. Please feel free to reach out to us at any point. A special thank you to our panel, Paolo, Danielle, Mary Ellen, and Lynn. We all appreciate your advocacy on digital equity and digital inclusion, and I'm sure we'll be hearing from more as we move forward with better broadband for Maine and a good digital equity and digital inclusion program. So thanks to everyone.
Thanks, Susan. Thanks all.
All right, and with that, thank you so much, Susan. Thank you to our panelists and speakers. I am just going to, we're going to take just a moment and again, thank our tech sponsor, Telco, for letting us put this on, supporting us to put this on today. We're going to transition to our next panel, which will be our last panel for today. If you've been with us this whole time, thank you. 3 hours is not enough time, but it is when you're sitting, it's a lot when you're sitting in front of a screen. So as much as we wish we could be in person, I'm glad that we are able to do it this way. And with that, I just want to remind you all this is being recorded. So if you've had to pop out, pop back on, if you're having troubles with your access, these will all be uploaded after the summit is over next week to the Maine Broadband Coalition's YouTube page. We'll make sure all of those links are easy to find on the Maine Broadband Coalition website, as well as sent out to everyone that registered for this event, seeing that there are some that weren't able to make it on today at all. So with that, if you just give us a moment, we're going to transition to our next panel and discussion.